Hi, my name is Natalie, and for my person today, I'm going to be using my stuffed animal. Her name is Stacy. I'm going to have it right here. And this one is going to be CPR for adult. The first thing I'm going to do is check the scene for safety. And then I'm going to check the victim for consciousness without moving them by tapping them and shouting their name. If the victim does not respond whenever I tap them and shout their name, I'm gonna look for signs of life, and if I don't find any, request someone to obtain an AED for me and someone else to call 911. Once the AED has gone to go get recovered and someone is on the phone with 911 and I see no signs of life, I'm going to shout no signs of life, beginning CPR, and start with compressions. With my left hand, I'm going to go ahead and place my heel of the left hand in the mid chest. On my other hand, I'm going to take it and place it on top. I'm going to straighten out my hands, lock my elbows, put my shoulders over my elbows, and compress for at least 2 inches at a rate of 30 compressions every 18 seconds. After we do 30 compressions for 18 seconds, we're going to go ahead and do a head tilt chin lift. I'm gonna pinch the nose and then give 2 breaths, making sure that the chest is rising with each breath. If the breaths don't go in, I'm going to reposition the head and give 2 more breaths. The chest doesn't rise with the second attempt of breaths. I'm going to assume that there is an airway obstruction and I will care for that. After the breaths have been given, I'm gonna go ahead and resume my compressions per minute. And I will not stop giving compressions or stopping that cycle until an AED shows up. Once the AED shows up, I'm gonna turn it on and follow the instructions that the AED gives. I will continue CPR until the AED says to stop. The only difference for CPR of a child is the depth of the compressions. For an adult, it has to be at least 2 inches of depth, but for a child, it has to be about 2 inches. So it can be a little less or a little more.